Next, I'd like to start talking about or answering some of the questions that you guys had written down. First off, they are very good questions, and it really helps me to reflect back on where I started with my career and really what sort of things that I would suggest to anybody starting off in the health and wellness profession. The first question was, what certifications do you recommend having to be a wellness coach? The two certifications that I'm going to talk about today are the one through the American Council on Exercise, which is a certified health coach. This was a little bit more applicable for me just because of the cost of it, and I already had my personal training through the American Council on Exercise, so I just kind of stayed with that organization. It was a little bit more feasible at about $500 for the certification. And the other one that I'm going to talk about is the Duke Integrative Medicine certification. This is a very reputable certification as well. However, I will tell you that you do need to have your bachelor's degree, where the American Council on Exercise, you only needed your associates. You need 3 to 5 years of experience, and it takes 4 months to complete the education. The cost of that is $2,200. So that was another reason I went with the American Council on Exercise certification. And what advice would you give someone interested in this career? The first thing I would say is definitely get your 4-year degree. I always feel that that gives you a firm foundation of education, and it also makes you more marketable. It can be tough starting off in this profession, mainly because there's so many different avenues you can take. You could go to the personal training route, you could go into the nutrition route. In that regard, I would definitely suggest you go either into the dietetics or a nutritionist bachelor's degree. You can still become a health coach after you get your 4-year degree. One route, when I reflect back on my career, one thing I think would have been very helpful for me, because I do work in a hospital setting, is for me to have become an RN. When you become an RN, your doors open up, and there are many different avenues you can go into when you're an RN. At Avera, where I work, and Sanford, they have many health coaches that are RN health coaches. So I am very limited with Sanford to get a job as a health coach, because they do recommend that you are an RN. Now at Avera, they do have health coaches in their integrative medicine department, and also with corporate health, which I have worked in the past. And with corporate health, it's more education and health screening. So that is a recommendation for sure that I would say definitely get your bachelor's degree. Figure out what sort of environment you want to be in. If you want to be in a hospital setting, then I would consider more of an RN or nutritionist or dietetics route. If you want to be in the health center or fitness center realm, then you could probably be fine with the exercise science or exercise physiology route. What skills do you most use on the job? And is every client similar or completely different? Just as anything else, everybody is different. You can't have a cookie cutter program when it comes to health coaching. I find that I never know what I'm up against when I first start meeting with somebody. I've never had a client that I've given the exact same protocol to the next client. Every single person is individual. The one thing I would say that does make them similar is probably 50% of my clients do want to lose weight. There is a stress management component. Some people want to train for a half marathon or a 5K. Those are the similarities, but people in general are very different, and you have to approach each client in a different way. Health coaching, this question here is, what is health coaching? Health coaching, for me, what I've kind of figured out as my slogan is, I want to help people where they're at get to where they want to be. And health coaching really is about behavior, teaching people about behavior change, the stages of behavior change, and what it takes to get people motivated to continue to move in the right direction. It really is a lot about asking questions and helping that client come to a conclusion on their own. Where is it that they want to be? If a client does not believe if we feel as a health coach that they want to lose weight, but they don't come to me for weight loss, that's not going to go well. It's really what they want to achieve is what we help facilitate. Do you have to have a serious health issue to benefit from a health coach? Absolutely not. I have people that have come to me for stress management. They want to start running a 5K. They want to have better sleep habits. They want to have clearer skin. They want to have more energy. They want to have energy with their young kids. They want their whole family to be healthier. Definitely not something that you have to have a serious health condition. If I have had clients that have come to me that have had diabetes, metabolic syndrome, and I did take a continuing education course on clinical health coaching where that really does come into play. I do enjoy working with that clientele. However, it's a multiple disciplinary plan there. You're going to have a doctor, a nurse practitioner, a dietitian, sometimes a counselor. It's not just usually you with the plan. It's usually several people helping this patient, helping them reach a better state of health. What type of schooling did you go to get where you are today? This is a little bit of what I talked about before. I wanted to make sure that I had my bachelor's degree and then continuing on with the reputable certifications. What part of your job do you enjoy the most and why? I love connecting with the clients. I enjoy seeing people succeed, but I will tell you it can be a really tough road. It can be 6 months of really hard work and 1 month where they feel really good. So it's not always fun. It's not always easy, and it can be very frustrating. Sometimes I feel like, oh, if they would just make this one change, that would help. But until that client or patient is ready, it's not going to happen. So you really have to be understanding of the fact that it's a personal choice for the client when they're ready. Until they're ready, changes won't happen. What is wellness transformation? This is a really broad question, but it is a good question. Wellness to me is whatever I feel is a positive state of being for myself. So my wellness transformation is going to be different than the next person's wellness transformation. For somebody who is diabetic, high blood pressure, high cholesterol, their state of improvement is much different than my next client. So I would just say that as that's a fairly broad question, I mean, obviously we would like to have people have their cholesterol in the recommended values. We'd like to have our A1C in the recommended numbers. We'd like to have people not have blood sugar issues. And we'd like to have people stay at a healthy weight. But I guess the wellness transformation really is, again, another individual state of being. What does a normal day look like for you? Well, I have 2 children, and I also work 30 hours a week at Avera in their rehab department, which is a department geared toward people that have had traumatic brain injury, stroke, car accidents. This is a long-term facility, and so I work in the aquatic center there helping the physical therapist with a patient. So I have 30 hours a week there, so I fit my health coaching in before I go to work. So most days I start at 5 a.m. and then I am done with my clients around 9:30, and then I start at the hospital from 10 to 4:30. It is very long days, but my kids are a little bit older now, so it makes it a little bit easier to work full-time and have a life outside of work. Do you foresee an increase in health coaches over the next 5 to 10 years? Absolutely. I feel that people are taking a more active role in their health, and maybe trying to stay away from the conventional medicines and maybe looking more to alternative routes of health and wellness. And so I do feel that people are going to be approaching more of the health coaching professions maybe rather than going to their medical doctor. Not that a health coach should take place of a medical doctor. I just feel that people, rather than going and asking their doctor about weight loss options, they may contact a health coach. Do you do most of your work online or face-to-face with clients? I like to be face-to-face with clients. I will do some sessions via phone. However, I think it's really important to be able to see people's facial expressions, body language, and you don't get that over the phone. You really can tell how somebody feels when you see them face-to-face. And I feel also that when you work with people face-to-face, there's definitely more of a connection. That is what I prefer, but I do have some colleagues that do a lot through Skype and via telephone, and sometimes people will just do through email as well. I've had to work with a few clients that way when they are vacationing or they've at school. So there's many different routes. It really just depends on what your preference is. What is the biggest challenge for you? The biggest challenge for me is the business side. I did not go to college for the business side of my business, meaning the money. Asking people for money is very difficult for me. So it's been an ongoing, I don't want to say problem, but it's been an ongoing situation that I'm getting better at. I use what's called the Square. Many of you have seen that. And I have people prepay for the month. This cuts down on last minute cancellations. It makes everybody just more accountable. So I would say the business side is the least enjoyable for me, but you can't have your own business without being able to get around that. So if you really dislike the business aspect, then I would definitely recommend that you work for an organization where that is taken care of for you. What is the biggest challenge for patients? I think one of the biggest struggles is for the patient to really figure out what it is that they want to change and how to change. Sometimes people come to me and just say they really don't know what to do, they just don't feel very well. So sometimes you have to have some really tough conversations with clients about what they need to do and peeling back the layers and figure out. Sometimes it's not very fun for patients. There can be a lot of emotions and there can be deep-seated things that happened in their past, and that will come up, and that I'm not always trained for, but the best thing that I can do is listen, and I can also be an advocate for them and help direct them. If they need to see a counselor, then I'm going to be that resource for them to say, you know what, let me help you find somebody. Or maybe it's a situation where they need to have a referral to a doctor. That's also my job, is to say, you know what, something doesn't feel right here. I think it's time for you to see your doctor. What is the average salary? The average salary in South Dakota, I'm honestly not quite sure what it is. I charge $40 an hour. I feel that people are willing to pay this, but I do feel that if you were to go to the hospital, you would probably be paying about $60 to $75 an hour if you were at a doctor's office. Now, that doesn't mean that you get paid that. I would say if you were to work at a hospital being a health coach, you would probably make anywhere between $20 and $22 an hour. What is the most important thing that I do? I feel that the most important thing that I do is when I have to intercept a major problem that's happening medically. I would say if somebody comes to me and you know, I can tell they're not feeling well. We'll check a blood pressure. Their blood pressure is really high. That's a time where I have to intercept a potentially dangerous thing. So I would say that's probably the most important thing that I do, that I recognize an emergent situation and I follow up with the appropriate resource. What is the difference between myself and a personal trainer? I would say that a health coach is different from a personal trainer because a personal trainer is going to focus more on the fitness aspect of wellness, where a health coach is really going to look at the whole picture. The fact that I was a personal trainer before, I do use a lot of the personal training when I'm working with my health coaching clients if they want that. But as a personal trainer, I would really say that they don't have the knowledge yet about how to help with the behavior change, and really when it comes down to the nutritional aspect as well. Do you get paid more than a personal trainer? This really does make a difference of where you're at. I think some personal trainers that have been in the industry for quite some time probably can get paid similar to what a health coach is. The difference is, as a personal trainer, you don't necessarily have to have a college degree or a certification. People can call themselves a personal trainer without a certification. So me personally, as a health coach, I am getting paid more. But overall in the state of South Dakota, I'm not sure, but I would estimate that a health coach probably would get paid more than a personal trainer. When is yoga a good option for building personal wellness? I think yoga is a very good supplement to our workouts. It's very good for people that struggle with stress management. I use yoga a lot with my athletes. And I also use yoga for people that really struggle with their flexibility, and also for a recovery workout for my athletes, and also for somebody who's learning to sleep better. I have a couple of different poses that I teach my clients if they struggle with sleep. How much of your plan for a client is nutritionally or diet-based? This all depends on the client, but I believe about 75% of my clientele would probably benefit from some sort of nutritional guidance. What is the main part of wellness that you focus on when you start with a patient? Again, this is very individualized, and I don't have a protocol that is cookie cutter. I would say that I let the first session the client just talks, and we really find out together what their first need is, and it really does surface. Usually, I would say probably 50% of the time it's nutritionally. I feel that nutrition affects everything. So this is very individualized, but if I had to answer, I would probably say nutrition. What is the general age of people that you work with? Well, the ages that I've worked with range from age 15 to 90. I have a 90, actually she just turned 91, and she is still wanting to lose weight. So I've worked with younger athletes, but as far as health coaching, the youngest was 15. This was a little bit of a tricky situation. It was a girl that was struggling with her weight, and so I really had to be careful. I had a lot of conversations with her mother as well as her doctor about the appropriate way to approach a weight loss plan for her. What is the most difficult aspect of your job? This one I already kind of touched on before, but definitely when it comes to the money side of my business, asking for payment. What made you want to do this for a living? I really feel that I have a passion for health and for helping people. Some of the more emotional aspects of your profession. One of the toughest things is when I see people struggling, especially with weight, and it's been going on for many, many years, and it is very tough. It can affect their marriages, it can affect their careers, And this is probably the toughest one, when I know that people really have a desire to lose weight, and for whatever reason, it's just a really tough struggle for them. What is my schedule like? Well, I touched on that a little bit before. Long days, but I have variety. I get to move around a lot, and it never really seems that awful, probably because I love my work. To what lengths do you go for a patient? This is a really, really good question. When I first started health coaching, something that I figured out was when I started working harder than the patient, then I needed to back off. When I first started off, I felt like I had to check in on the client all the time. I had to send them lots of resources, reading material. And I've learned as I've been in the profession longer that I really need to step back during the session, offer the information, and then let go and let the patient do their work. It's a lot about personal responsibility. Again, when I found that I was doing more of the work than they were, then I realized they're not going to be successful. Well, that's the end of the questions. I have very much enjoyed spending time with you today. And please, if anybody would like to email me directly, feel free to do so. Your instructor should have my information. So good luck.